Hello everyone, and welcome to the DPS Education Program presentation on the NCLEX 2026 to 2029 update. Today, we will review what has changed and what has stayed the same in the new NCLEX RN test plan. This update is very important for nursing students, international nurses, and anyone preparing for the NCLEX exam. Understanding these changes will help you study smarter and focus on what truly matters for passing the exam. The new NCLEX test plan becomes effective in April 2026 and will remain valid through 2029. The biggest focus continues to be clinical judgment, but now there is also a stronger emphasis on health equity. This means the exam will test not only what you know, but also how you think, prioritize, and provide fair, patient-centered care for diverse populations. Many students worry that everything has changed, but actually, many core elements remain the same. Computer adaptive testing, also called CAT, is still used. The NGN format remains active. The exam length and timing remain similar, and the concept of the passing standard has not changed. This means students should continue using strong NCLEX strategies they already know. The next generation NCLEX is still the foundation of the exam. Case studies remain a major part of testing. Bow-tie questions continue to appear, along with SATA, which means select all that apply questions. Most importantly, clinical judgment remains the center of the exam. Students must learn how to think like a nurse, not simply memorize textbook information. The biggest new change is health equity. Students must understand cultural competence, social determinants of health, bias-free care, and patient-centered approaches. Nurses must recognize how language barriers, financial problems, transportation issues, and cultural beliefs affect patient outcomes. NCLEX now expects nurses to provide safe care for every patient fairly and respectfully. Some important terminology has also changed. For example, the phrase substance abuse is now updated to substance misuse because it is less judgmental and more patient-centered. Also, safety and infection control is now called safety and infection prevention. These wording changes reflect modern nursing practice and professional communication standards. Clinical judgment remains the heart of the exam. Students must learn to recognize cues, analyze cues, prioritize hypotheses, and evaluate outcomes. This means identifying patient problems early, understanding what is most urgent, deciding the safest action, and checking whether interventions were effective. This process mirrors real bedside nursing decisions every day. The exam now places a stronger focus on managing multiple patients at the same time. Nurses must prioritize care across several patients, handle real-world scenarios, and make safe delegation decisions. This reflects actual nursing practice where nurses care for multiple patients and must constantly decide who needs attention first. For students, this means less memorization and more critical thinking. The focus is now on safety, priority setting, and real-life application. Instead of asking what disease is this, the NCLEX asks what should the nurse do first. Students must prepare by practicing decision-making rather than only reviewing content. At DPS, our strategy is designed for this new NCLEX style. We provide NGN-focused training, step-by-step reasoning methods, priority and safety frameworks, and bilingual support for international nurses. Our goal is to help students understand how to think through questions confidently and apply nursing judgment correctly during the exam. At DPS, our strategy is designed for this new NCLEX style. We provide NGN-focused training, step-by-step reasoning methods, priority and safety frameworks, and bilingual support for international nurses. Our goal is to help students understand how to think through questions confidently and apply nursing judgment correctly during the exam.